All right, also new tonight here on The Current, we are turning to a big upgrade for a local healthcare center. Iowa only has one burn treatment center in the entire state. That's the University of Iowa's Burn Center. In fact, it's one of only 39 verified burn programs in the nation that treat both adults and kids. This month, the center celebrated a major expansion and renovation. Check it out, it now has 4,500 more square feet. Its capacity increased from 16 to 21 beds, and there are also updated inpatient rooms, 2 private hydrotherapy rooms, and a dedicated outpatient clinic. And all of this will mean more care available for patients. It's why we have Dr. Samuel Jones, director of the University of Iowa Burn Treatment Center, joining us right now on The Current. Dr. Jones, thank you so much for your time and being here with us today. I want to start with what you thought when you got to see the completed renovation for the first time.
We were ecstatic. That's what we thought. But our immediate thought was, now this expansion, what it means to us is we have the ability to expand our service throughout the state and throughout the neighboring 6 states around us. This is not only going to impact both our patients and families. Now they have more access to specialized burn care. The experience for the patient and the family will be enhanced as well. And we will continue to deliver the high quality, comprehensive burn care, both in pediatric and adults. So
Dr.
we
Jones,
are been
I'm glad that you brought up that 6-state radius that you guys work for. Serve? How many patients do you guys treat every single year?
Our numbers have increased substantially over the past 2 years. We we are seeing, I think, well over 500 burn patients, but we also take care of frostbite. We take care of complex wound infections. You heard of flesh-eating wounds. Those numbers only include burn patients, and those numbers only include adults. But we're fast approaching probably 1,000 patients a year.
Wow, and it's really interesting to think about, how rare these types of centers are and how specialized the treatment is. And some people are traveling hours to come to the University of Iowa Burn Treatment Center. So now that you have all these upgrades and renovations, what will this allow you to do that maybe you couldn't do before?
This will allow us to continue to do what we do, which is provide the comprehensive, high quality care. But with our throughput, it's going to increase our access. So any citizens of Iowa, we don't want them to go to another facility outside of our great state. We want them to come here to the University of Iowa. We have an open access, so anyone who needs us has the ability to come here. Like I said, it's not limited to just Iowa. We take care of many patients on the states that border us.
Yeah, and I was reading too about how now it's kind of a true one-stop shop. A lot of patients now will not have to switch hospitals for more specialized care down the road. And that kind of brings up an aspect of, burn treatment centers are not just treating the physical wounds. There's a really intense emotional aspect to this, of these wounds that also need to be addressed. How do you and your team
Yes.
tackle that?
Our team is very emotionally invested in the patient and with the families. Now, there's a lot of scars from burns, but what most people don't know, there's scars you can't see as a result of a burn injury. So we treat those scars that you can see, but more importantly, we treat those scars you can't see. And we're not only treating the patient, we're treating the families and their friends. So our care is very comprehensive technically, but also when it comes to empathy and emotions. I think that's the separator for this particular burn center. The staff that work here care deeply about what they do, and they're very dedicated, and they do it 365 days a year, 24 hours a day.
hmm So, Dr. Jones, before I let you go, can you give us some tips here? What are some of the most common burn injuries that you and your staff see, and how can we avoid them?
In children, smaller children will be hot liquid burns like ramen noodles. That's very common. They take them out of the microwave, or they get spilled onto their chest or back. And then adults will be any type of flame burn, cooking, fall into fire pits, which is very common during this time of year. Working on outside, cooking on grills, you can see those type of accidents. People who see us are not expecting to be in the burn center looking at us when they show up. So it's always some unpredicted event that lands them in the burn center. So you want someone like the people who work here, who are on staff here, to be waiting to get you, take care of you, heal you, and get you back into what you were doing prior to that unfortunate event.
And now with these expansions and renovations, you guys can treat even more people. Dr. Jones, thank you so much for your time today and congratulations.
Well, thank you.
If you guys at home want to share this story, our online version is up at WQAD.com underneath the As Seen on TV tab.